Good morning. I'd like to welcome you to today's session, MRT therapy. We will have the combination of a video presentation this morning, and then our two speakers will be presenting additional information from yesterday. I would now like to introduce Dr. Zhukovsky and Dr. Sitko.
Thank you very much. Dear ladies and gentlemen, dear colleagues, we begin our report, our communication from short video film about microwave resonance therapy in the Soviet Union, in Ukraine, in the Kieve. Please.
On the threshold of the medicine of the future, ancient Kieve, the capital of the Ukraine, the city where ancient history and present-day life have mingled harmoniously. In Kieve, the first in the country Academy of Sciences, famous all over the world by its traditions and science schools, was founded. Perhaps it was not by chance that Scientific Research Center OTKLIK has been recently created in our city.
Научно-инженерный центр OTKLIK.
Eight years ago, in May 1982, three Ukrainian physicists from Kieve University, Andreev, Biely, and Sitko, announced to the World Scientific Association that they discovered a manifestation of special characteristic frequencies of a human organism. This is a brand new approach to the treatment and prevention of diseases, and I think that to a great extent it determined the success of microwave resonance therapy, used not only in hospitals of the USSR, but also abroad in Europe and in the continent of America. At present, in cooperation with Kieve scientists, we are investigating the ways of increase of natural organism resistance to malignant tumors under the impact of microwave resonance therapy. Microwave resonance therapy is a brand new method of treatment. It enabled to speak about the treatment of, first of all, incurable diseases. And we are approaching a new level which will provide the treatment of hope. Our laboratory created a device for MRT, the only one in our country that was accepted suitable for this type of therapy. This device is called Pirog, meaning threshold. It is based on the discovery made by OTKLIK.
Открытие, которое было сделано в отклике.
Physics, biology, medicine, on the verge of these three sciences, new amazing discoveries have been made by Kieve researchers. Manifestation of characteristic eigenfrequencies of human body allows to explain diverse differential stability of the life. That is the possibility of existence of species, genera, and we may say that this is a man, a monkey, this is a cat, a unicellular organism, one on another or another species of plant, and so on. We showed that the cause of such diverse differential stability of the life is of the same origin as the varied differential stability what the structural levels of organization of matter. That is, it lies in the very possibility to name various types of nuclei, atoms and molecules in the fact that there exists the periodic table. As is known, this is all based on principles of quantum mechanics, principles of identity and discreteness. It was demonstrated that the same principles could be applied to the living systems. Starting from the pioneer works written by Froelich, the author of superconductivity theory in the 60s, investigations are going on. The author applied the ideas of coherence to the living systems. We developed these ideas and demonstrated that in the living systems there appears the real coherent electromagnetic field in which, according to the laws of quantum mechanics, there emerge levels and there exist selection rules forming characteristic eigenfrequencies and so on. On the basis of this radically new approach to the living systems, a new medicine, the so-called microwave resonance therapy, was created.
К живому создалась новая медицина, так называемая микроволновая резонансная терапия.
Новая отрасль медицины. Что даст она человеку?
A new branch of medicine. What can it give to a man? What vistas is it opening up on the threshold of the third millennium? It is sufficient to say that besides exceptionally high results of the treatment of conventional diseases, microwave resonance therapy is quite useful in management of those patients who previously were considered incurable. Alcoholism, drug addiction, toxicomania present a great concern to the world today and threaten death not only to some patients, but to the whole peoples and nations, as United Nations Organization states.
Организация Объединенных Наций эти недуги грозят гибели целых наций.
That is why obtaining good results of application of microwave resonance therapy in this sphere is considered to be a great achievement. Besides a number of dermatoses, such cutaneous diseases as psoriasis, pemphigus and others, which were thought to be incurable and for which humanity has been suffering for centuries, are now amenable to microwave resonance therapy. In this respect, exceptionally significant is our experience abroad, when, in order to be certain of the method's efficacy, we were given some patients who were considered to be twice incurable, rejected both by traditional and non-traditional medicine. In this case, a high percentage of success proves a significant efficiency of this method. I shall dwell only on the two devices which are most widely used by our colleagues and by us. This is a generator which suggests a choice of individual characteristics and, as we call it, a therapeutic frequency for a patient. And the other one is a portable generator of Prof type with wide range of frequencies that allows a diseased organism to select the necessary characteristic frequency. These are the two types of most usable instruments. All I am speaking about was considered by International Commission of the extremely high level in May 1989 in Kieve. The Commission highly evaluated the results of our work, which are described in this book, published in Kieve in 1989.
Которое издано в 1989 году в Киеве.
Today, this new method can be compared with a bridge between traditional European and ancient Oriental medicine. matter is that the system of meridian acupuncture has the centuries-old, to be more precise, 2,000 years old history. But due to Kieve scientists, physicists from Kieve University, it acquired a new impulse. The point is, and I want to stress this especially, that mechanical irritation of biologically active points, acupuncture points, differs in principle from the new original therapeutic impact developed by Scientific Research Center OTKLIK. I would say that this is a physiological subthreshold impact. The utilization of microwave resonance therapy in oncology has many aspects, including anesthetic effect, which is very essential because of the growing number of cancer patients. As you know, our success here is quite modest, but it is necessary to make life of such patients more comfortable. The investigations which we conducted in cooperation with OTKLIK demonstrate that microwave resonance therapy is an effective way to relieve or to weaken pain syndrome. The second aspect, a wide audience knows that oncological patients are treated with chemotherapy. All chemo preparations kill medullary hematopoiesis, resulting in abrupt decrease in leukocyte number up to 2,000, when norm is 5,000-6,000.
Поэтому число лейкоцитов у больных резко падает. До 2000, норма 5, 6, 7 тысяч, падает до 2000, и уже это опасно для жизни дальше проводить.
Proceeding with chemotherapy is life-threatening. Why? Because leukocytes are the organism's warriors, and when they sharply decrease in number, there appears a danger of the significant problem caused by a simple cold or any infection. So it is MRT which helps to quickly restore myelodepression, so to say, depressed medullary hematopoiesis. It is an extremely essential. All new ideas in science are experimentally proved. Therefore, engineering development is closely connected with scientific investigations in OTKLIK. In our laboratory, we develop new devices for microwave resonance therapy and deal with investigations of the interaction between microwaves and living organisms, what is now called physics of their life. Powerful instrumental potential is concentrated in our laboratory, which makes it possible to register super-weak fields of biological objects, and these fields are in the millimeter band range. The same equipment allows us to adjust and make metrological investigations of those devices which we developed for medical purposes.
И второе, эта же аппаратура позволяет нам настраивать и проводить метрологию тех устройств, которые мы разрабатываем для медицины.
The principal novelty of the method of microwave resonance therapy is determined by the following two aspects. First, we use electromagnetic radiation of extremely low intensity. The energy received by a patient undergoing MRT can be compared to that which a man would receive sitting near an ordinary electric lamp. This low intensity determines the necessity of the investigation of new reactions of an organism to the electromagnetic radiation of extremely high frequency and low intensity. For this purpose, we use a number of new methods, primarily the investigation of thermal fields of an organism, methods of electroencephalographic reaction study, and others. The second aspect, which allows us to speak about principal novelty of the method, is a local character of the impact. Biologically active points are affected upon, and these points have been known since the times of ancient Chinese medicine. It is well known known that people who work for a long time in the conditions of electromagnetic radiation impact do not respond to MRT. But in this very case, a therapeutic effect is observed. We may compare it to the effect of a routine medicine. If you take any medicine in any dosage, it will most often cause negative effect. Only proper combination of medicine, its dose, and way of application may produce a new remedy, which is quite useful to a man. Evidently, the same is with this new physical factor, certain combination of dosage, frequency, and the site of exposure. We have obtained principally new results of treatment of various diseases which were amenable to no therapy. First of all, it concerns broncho-obstructive diseases, diseases of nervous system, and others.
Делают в их ситуациях вреден, который несет вред, делают из него лечебное средство. Мы получили принципиально новые результаты в лечении целого ряда заболеваний, которые никакими другими способами невозможно было вылечить. Это прежде всего относится к бронхообструктивным заболеваниям, к целому ряду заболеваний, связанным с поражениями нервной системы и ряду других заболеваний.
Именно к таким. Вчера еще
Yesterday, infantile cerebral paralysis could be classified as an incurable disease. Today it is successfully treated by OTKLIK physicians. Here, the results of the microwave resonance therapy are vivid and impressive. We came here from Altai region, from Rubtsovsk city. I came from the city of Kremenchuk for the 8th time. We came from Altai too for the 4th time. We came from Kieve region for the 6th time. We came from Chernobyl. This girl started a course of treatment a year ago. Previously, she couldn't sit, she couldn't walk at all. She could stand with two side support only. After the third course of treatment, the girl could sit and stand without support. Now she is trying to walk, supporting herself with one hand. Now she will show us how she can stand herself. Show us how you can walk. Don't be shy. See how you can stand. She is trying to stand without support. This is a child who previously couldn't walk at all. Here, now you can see another child, Zhenichka Miltsin, who came from Altai region. He is having a 4th course of treatment here. He had severe disturbances. His lower extremities were bent in ankle, knee, and hip joints. He could stand only supported by his mother. His dorsum was semicircular. After treatment, the boy can stand almost without support. His legs became more straight. This is a severe form of incurable disease, incurable from the point of view of traditional medicine. Unfortunately, conservative measures often produce no effect. Due to new developed methods of treatment, microwave resonance therapy particularly, our possibilities have increased greatly. Now we can help these children who previously couldn't receive the aid from traditional Medicare. After our treatment, the children acquire new motion abilities. Some of them start walking, standing. Hand functions improve essentially. These children will live in the 3rd millennium. That is why their health and ability to live a life of healthy people is our greatest concern today. But still, physicians confront a lot of problems. During the last decade, drug addiction spread all over the world. To say nothing about such malicious disease as chronic alcoholism. These two diseases present one medical problem, which was called narcology. Our group was given a task to try using MRT to affect physical and mental dependence of organism from drugs and alcohol. During 3 years that were at our disposal, we partially solved this problem. Today we have proved that microwave resonance therapy affects the basis of biological attraction for alcohol and drugs. The scientists of our laboratory have developed a number of methods with the help of which we obtained a number of evidences to the fact that influence the underlying basis of pathological drug and alcohol attraction. By this time we have cured 200 chronic alcoholics and 150 persons suffering from drug addiction.
Мы получили убедительные доказательства, что действительно мы влияем на основу, которая биологическую основу, которая лежит в основе патологического влечения к спиртному и к наркотикам. К настоящему времени мы уже вылечили около 200 больных, страдающих хроническим алкоголизмом, и около 150 больных наркоманией.
Alexander, 2 months ago you underwent treatment here. How are you feeling now? What problems do you have? Can you compare our methods of treatment and those which you tried previously?
И вообще вы можете как-то сравнить вот наш метод лечения и вот то, что вы раньше когда-то лечили с традиционными методами лечения вот, в наркологических стационарах? Пожалуйста.
I have been suffering from drug addiction for quite a long time. I tried to be cured several times but failed. The treatment caused only partial relief. At present, after the session of your treatment, I feel well and get fixed up in a job.
В данный момент, сейчас, после вашего курса лечения, я себя чувствую нормально, устраиваюсь на работу.
Our therapeutic course duration is quite short, 10 days only. When did you start feeling a relief? What about the relief of your abstinence syndrome? After the 3rd or 4th session, appetite returned, insomnia disappeared, and in general now I feel much better, better than ever. Narcological pathological states are associated with chronic organism intoxication by drugs. But this is a nonsense. The fact is, 90% of drug addicts are treated with various medicinal preparations, though the organism of these patients is overstuffed with numerous chemical substances. That is why MRT method has a great future. It enables us to treat patients using no medicinal preparations, outpatiently, anonymously, not suppressing patient's personality.
Позволяет лечить наркологических больных безмедикаментозно, в амбулаторных условиях, анонимно, не подавляя личность больного.
Fighting for human life and health. Literally saying, Prog is working miracles. The range of its application is immensely wide and diversified. Himalaya, the land of high mountains and snows. Everyone knows that mountaineers are absolutely healthy, but in the extreme conditions, the threshold of human endurance is sharply decreasing. In this situation, it was the device Prog, easy and reliable in operation, that rendered help to the participants of the second international expedition Himalaya 89. It became their source of strength and vigor, their reliable assistant. Scientific investigations in OTKLIK attract the attention of foreign scientists. Today, colleagues from the United States of America are the guests of Kievite. The scientists are learning to communicate with human organism in its own language. from the pragmatic point of view of the wide audience, the peculiarity of microwave resonance therapy lies in the fact that it allows to restore functional status of an organism non-invasively, not piercing skin surface, only with low-intensity fields in the millimeter band range. This room is illuminated well, but it will get dark if the lamp is off. The intensity of the electromagnetic radiation, which restores an organism's functioning, is billions, hundreds of billions times smaller than the one in the dark room. Today we may at last distinguish a sick person from a healthy one. This is one of medical problems which has yet been unsolved. At all times there arose the debates how many medicines should be given to a patient, and it is very easy to go too far. But we say that a healthy person is an individual who does not react to electromagnetic radiation in the millimeter band range in any range of investigation and impact condition. It means that somatically we transfer organism only to the state of health. Fortunately, because of processes of self-organization and due to the emergence of the symmetrical potential well, organism is built in such a way that there is no danger of overdosage, over-treatment, which may result in certain complications. It is impossible in principle. In addition, if microwave resonance therapy effectiveness in treatment of traditional diseases is nearly 90–95%, and in treatment of incurable diseases there is nothing to compare with it, then I think future belongs to microwave resonance therapy. And it is not only because of its effectiveness, but due to the fact that for the first time it may be based on the firm theoretical foundation. For the first time, as it seems to me, medicine and biology get a theoretical basis. They become similar to other fundamental sciences, such as physics, quantum mechanics, electrodynamics, and so on.
А потому что впервые, может быть, она основана на прочном фундаменте, теоретическом фундаменте. То есть впервые медицина и биология, как мне кажется, получает теоретическую основу. Она становится такой же, как и фундаментальные науки, как физика, квантовая механика, электродинамика и так далее.
We are on the threshold of the medicine of the future. The investigations of the Ukrainian scientists make this time closer. Interbranch Science and Engineering Research Center of Physics of the Alive and Microwave Resonance Therapy OTKLIK, created under the auspices of the Council of Ministers of Ukrainian SSR.
Now, after the lecture of Professor Sitko and this film, you passed the courses of education of microwave resonance therapy. And my task give to you only any remark to microwave resonance therapy. Now, it is a very interesting situation in the world. Excellent situation between the patient, doctor, and drugs. And name of this situation, this is crisis of health care. Because too much disease, too much drugs, the doctor need increase the quantity of the drugs. The increase of quantity, the drugs increase side effect. All the patients have one, after treatment 2, and after several years, 10 disease. This is circulus viciosus really exists in comprehensive health care. But diseases, this is not relation between doctor, patients, and drugs. Diseases, this is very complicated process. And diseases, this is acute or chronic dysfunction of the development of life process. And for treatment, patients it is necessary to know original of life process. You know, this definition of the disease determine of several direction in the experimental and clinics medicine: molecular biological dysfunction, cellular pathology, organ pathology, functional pathology, general cybernopathy, and psychopathology. And for treat the patient, it is necessary to know all this direction in the relation between patient, disease, and physician. But when you treat the patient, I said now already that we increase the quantity of the disease, you received side effect, and this is circulus vitiosus, finish the meeting, the patient and the doctor on the Marlborough table. And this is last meeting of this person for only one purpose: confirm the coincide of the diagnosis and cause of the death. In this relation, often the physician forget the definition of the health and the process of the health. And the definition of the health, a process of the health, this is not also very important. And definition of the health, health is a state of complete physical, psychic, and social well-being, and not merely the absence of the illness and infirmities. And the process of the heal, this is biochemical, morphological, physiological, psychological, and other aspects of the health. And now the scientists have very good opinion dismembering whole in the part. And this dismembering we have in medicine hours. And we treat liver, kidney, brain, and other organ. But some of this organ, this is not whole patient. Homo sapiens have the feeling, have the dreams. Homo sapiens like one person and don't like other person. And it is not possibility include this process at the process of the treatment. And the peculiarity of microwave resonance therapy, this is a basic approach to the state of the health, to the state of the illness, based on the fundamental science. We have, of the point of view on quantum mechanics, only two states: the states ground and the states metastable. Health, this is ground state; illness, disease, this is metastable states, as like as the trigger system. And if you consider, if we use our imagination of 1 minute, we have possibility divided some elements of physical intactness in 3 areas. This is health, this is sickness, and this is death. And the second peculiarity of the microwave resonance therapy, that these factors, extremely high frequency electromagnetic wave, have the action only in the system, pathological system. if biological object, if the patient haven't the disease, you haven't the influence of the microwave resonance therapy, because each patient have the himself characteristic even frequency in the extremely high frequency diapason, and you can possibility influence only in pathological process at the patient. I know only one special kind of the influence, the microwave resonance therapy on the normal patient, normal organism. This is influence of our chairman, of family of our chairman, Mrs. and Mr. Ross, because he have attention to our method microwave resonance therapy, and thank you very much for your attention us in this meeting, because this is first cases on the influence microwave resonance therapy on the man without pathology. Thank you very much from Professor Sitko from me, and thank you very much from all Soviet Union people and Russian people and Ukrainian people, because microwave resonance therapy have big influence of the Soviet people, because Soviet people now have too much pathology. And the last stage of this pathology, his name 500 days. Now, when you utilize ordinary method of the treatment, you have possibility improve the states of the body in this area, sickness only. Third peculiarity of the microwave resonance therapy, this is possibility to change the states of the illness, metastable states, in the ground states and the health. And often 3, 4, 5 treatment, this is enough for this transformation. And if you have the states of death, you haven't the influence of microwave resonance therapy, and this is good indices for determination of the end of the life and beginning of the death, because this is problems is very important for all the field in the clinical and experimental medicine. This is method of microwave resonance therapy. This is influence with extremely high frequency electromagnetic wave on the area of the point acupuncture or outside meridian point. And here you look the any kind of the generator. This is old generator and new generator. You have possibility to look at the movie and at the table here. In these cases, you tune the frequency for find the eigen frequency for these patients. Here other kind, here other kind of the devices. In these devices we have the white noise, and from white noise you patient's body select from this white noise again frequency for him body. And now results. This is results of the treatment of effectiveness of the microwave resonance therapy in 1,358 patients with peptic ulcer. Peptic ulcer, stomach and duodenal process ulcer. Complete healing you have here in 79.9%. Between the patient we have 93% of patients with duodenal ulcer and 6.3 stomach ulcer. This is normal relation between two localization of this process. And we have 70.6% and in the 15% between this patient ulcer decrease, the volume of ulcer decrease at the 50% and 2.5% without effect. But this is not our data. This is data clinics, big gastroenterological clinic which started to work and utilize our method. In our clinics results is more high. In our clinic complete healing we have in the 47% of the cases. This is result, this is effectiveness of microwave resonance therapy in 70 patients with alcoholism. The abstinent block we have in the 68.6%. This is very high results for this pathology. Abstinence decrease we have in 28.6%. And addiction blockade, drug abuse blockade, we have after treatment only in 52.9%. This is very high results for this pathology, but this is also not our result. This is results of big clinics, special clinics in Moscow, which started to work and utilize our method. We have results anymore. This is result of effectiveness of microwave resonance therapy in the 50 patients with opiomania. We have abstinent blockade in 78.0% and 22% abstinent disease. And addition blockade we have in 52%. This is also the results of this is big special clinic in Moscow.
What is opiomania, sir?
Opiomania, this is drug abuse. This special drug like as opium.
What is abstinence and alcoholism?
Interrupt. And in one patient interrupt utilize of the drug, and one patient have only improve during abstinence station, but after first courses prolong the utilize of the narcotics. All the ulcer process have the very good results during MRT treatment. This is trophic ulcer. This is results after 3 treatment. And this is after first courses, after 10 treatments. This is our results in the field of the infantile cerebral paralysis. This is more severe cases which not treat in the very big center on infantile cerebral paralysis in Moscow. You see now the result in the Kieve. This is picture from Moscow clinic. This clinic have 450 beds for children with infantile cerebral paralysis. Yes. And excuse me, this slide mixed, and this is very interesting slide because after treatment with MRT, we have very good results in the cases of psoriasis. But this is not demonstration of good result. This is very interesting fact that psoriasis process beginning from the point of acupuncture. This is next cases, several cases of infantile cerebral. And this is demonstration. It is necessary to beginning the treat the children with this disease as soon as possible. If you beginning to start the treatment in the 2 or 3 months, the results of treatment is excellent. All these children no possibility during several years to stay and to go. And now you see the result, the state of station of children improved. Microwave resonance therapy have good results in prevention the disease to the patient. We have the result of prevention in oncological disease and other kind of disease. You see the report of Chief of the Oncological Center and in Armenia region. And microwave resonance therapy have capacity increase the attention for operator. And this is results only one treatment of the pilot after 12 hours flight. And if you, excuse me, no, this is before treatment and this is after treatment. The level of the attention and quantity, the level of attention increase and the level of the mistakes decrease. This is very important for rehabilitation in the different field, different kind of the person. Now, thank you very much for your attention. Thank you for everybody speakers, because when I send the prospect of our meeting and read all the short communication, I understand that this is big progress in medicine and big progress in our relation. Thank you very much for everybody, because you come in my report and have hard patience my bad English in the Sunday. Thank you very much, because for me this is high honest. And thank you very much for our government, for Mr. Gorbachev and Bush, because they give for us possibility to have the relation communication, and I hope that microwave resonance therapy will be success in United States, and medicine United States have been success in USSR. Thank you very much.
The frequency or the power vary according to the different ailments?
Yes, but in the second kind of devices, intensity is very low. This is 10 minus 12 or minus 15 watts. Yes.
For our point of view, the level of intensity ought be very small compared with the cell, with the eigen intensity of human body, of electrical processes, non-linear electrical processes, a coherence moving electrical system. And therefore, when in the first of our experiments we used the equipment with the intensity about 10 milliwatt, now is the same equipment as you see here. It's possible to decrease the intensity in 10 degree time. In the other case, 10 in 10 zero times. In such a case, it's possible only saturate the resonance part, because in other case we oversaturating and the resonance is spreading, and therefore it's not good for treatment. You see, it's necessary to select such a level of radiation that only select the resonance part. According to the theory of Bohr-Maxwell of non-linear electrodynamics, it's possible from such a position to use equipments which give us possibility to automatically select the therapeutic frequency. In other case, if we used the generator with the white nose, and the intensivity comparing with the intensivity of electrical coherence processes in human body, in such a case, only resonance part of electrical profile of organism ought to be saturated, and potential part not saturated. It's linear interaction. Repeat. I'm repeating. Resonance part ought to be saturated. It means that it is non-linear processes, and linear and part not resonance part, potential part, is the linear interaction. And therefore it's realized automatically system of tuning, only resonance part. Because in a case when the organism is destroyed, not absolutely, but destroyed somewhere where it's possible to distinguish a resonance from not resonance, resonance connecting with the ordinary system of activity, connecting with the running way, the one case. And where is it possible to distinguish running way from the standing way, from the soliton type of mode of coherent system. In such a case, possible to use more simpler equipments which give possibility to select from the white nose, from the great band of radio frequency, to automatically select necessary frequency to saturate it. But in case of heart pathology, whereas I can show you 2 days ago that in case of, for example, cancer, the cells from tumors have a very great different type of resonance, not only good slope resonance, but splitting resonance and changing the position of maximum and other. In such a case, using simplest equipments with the name POROC, which give possibility to select automatically, is impossible. It's necessary to select special on the frequency or therapeutical frequency. In such a case, this method of seeking of this frequency, prolonging maybe 2 days, maybe 5 days in special clinic. For example, in the sugar diabetes, our clinics also using method MRT, but it's in such a case necessary very sharp tuning of resonance, because the breadth, the width of resonance in such a case is very narrow. It's with the quality on the language of radio technical quality of resonance, it's 1,000, and in any case many thousand, and therefore it's possibly very great, very good tuning. In such a case, necessary have a special equipments to give possibility to tune on resonance in real time. Because ordinary medicine equipments, for ordinary case, it's not necessary to know the changing of organism staying in real time. It's just a moment, in 2 seconds, 5 seconds after influence. Yes, in ordinary case, in ordinary medicine, it's enough to know what's happened in 2 hours, on next day. It's not mentioned, it's necessary to repeat after you putting your drug in your pills. Nobody want to know it's in 20 seconds, it's better for you or not. It's ordinary, it's necessary 2 hours to dinner, 2 hours before breakfast, and special talking about this. And after some months, some weeks, possible to control what's happening. But now it's necessary to use only special medicine equipment, which give us possibility to control, to check the states of human body in real time, in time of activity, in time of influence, in time of MRT, because it's necessary from million possibility find the necessary frequency and check this happened in such a moment. It's creating alpha rhythm in encephalogram and is increasing the blood pressure and any other eliminated pain is very good. As a rule, is the best method used with our doctors in medicine practice. It's eliminating of pain. In any case, before procedure, it's recommended of patient to provocate. For example, if it's forbidden some eating, if they provocate something, because it's necessary to sharp. Tuning is necessary to be a sharp pain in such a moment. It's such a moment possible to very good tuning on resonance.
The wish of Professor Sitko discussed with you as more as possible, because the movie star which plays our role in the film looking better, but he is no small about MRT, and the information is short. But now Professor Sitko have any supplementary for you. Thank you very much.
I'm sorry that we do not have any time for more questions. But we do have a round table, I believe 2:45 to 4, where we will have the speakers on the podium, and then more questions can be asked at that time.
Not forget your questions, please.
Yes. Also, we had given a plaque earlier to Dr. Sitko. I'd like to give this plaque thanking Dr. Zhukovsky, and can you please join me in a round of applause for our speakers?
Yeah.
Thank you.
Thank you.